Hello, my name is Hannah Wise.
My name is Tiffany Trine.
And I'm Jasmine Sullivan.
And I'm Emmanuel Chukano.
My name is Elias David.
And we are a Health of Today organization. Our focus is on the health of the lesbian, gay, bisexual, and transgender community, or the LGBT community. Lesbian, gay, bisexual, and transgender individuals are at a high risk for mental health disorders. To be clear, being lesbian, gay, bisexual, or transgender is not a mental disorder. The societal factors that come along with being lesbian, gay, bisexual, or transgender cause a great amount of stress, which causes mental health disorders. The American Psychological Association calls this the minority stress model, which states that stress accounts for all mental health disorders within this population. The stressors include general stress, which is job loss, not being able to get a job, not being able to get married, and discrimination, which includes healthcare discrimination, adoption, not being able to get housing, and other day-to-day activities that cause a great amount of emotional stress, which cause mental health disorders. Prejudice events such as bullying and violence are also many stressors that this community faces, but these will be talked about later. Proximal stresses are stresses that the individuals put on themselves, such as fear of future rejection, hiding sexual orientation, and internalized societal heterosexist activity, also known as internalized homophobia. All three of the proximal stresses play a large role within each other. Having that fear of future rejection causes one to be not happy with their sexual orientation, which causes the internalized homophobia. Having to hide their sexual orientation because of the fear of rejection also causes internalized homophobia. Homophobia is the main cause for clinical depression within this community. Homophobia is a negative attitude towards homosexuality. According to Healthy People 2020, all of these stresses play a large role in the mental health of these individuals, which causes suicide and substance abuse, which will also be talked about later. According to the National Institute of Health, homosexuals compared to heterosexuals are 8.4 times more likely to attempt suicide, 5.9 times more likely to be clinically depressed, and 3.4 times more likely to practice unsafe sex or use illegal drugs. According to the Center for Disease Control, men who have sex with men or gay men are at the highest risk for contracting HIV or sexually transmitted diseases, which will be talked about later. Having to live with this disease or knowing someone who has passed away or is suffering from one of these diseases cause a great amount of emotional stress, which will cause mental health disorders such as depression or bipolar disorder. Men who have sex with men or gay men are at the highest rate for attempted suicide compared to lesbian, bisexual, and transgender individuals. A study done by the American Psychological Association compared heterosexual women to bisexual women and lesbian women. Surprisingly, lesbian women and bisexual women actually had a greater amount of self-esteem. According to womenshealth.gov, this may be because the lesbian women and bisexual women do not care so much about their physical appearance as heterosexual women do, which will also be talked about later. They also have a tight community or a sisterhood, which causes them to have support with each other if they are going through self-worth issues or depression. This is not to say these women are not at risk for clinical depression or other mental health disorders. They still undergo a great amount of discrimination and social stigma. Bisexual women also have a greater amount of clinical depression or generalized anxiety disorder, as they have that fear of future rejection from both the gay and straight communities. Lastly, transgender individuals have a high rate for mental health disorders. According to the American Psychological Association, today physicians require that those who are requesting a sex change be checked out very extensively to make sure this sex change will actually improve the mental health of these individuals. Gender dysphoria is the term used by psychologists to explain the individual confused about their gender. Changing gender has shown to greatly improve the mental health of individuals, but long-term effects have shown a rising of clinical depression and generalized anxiety disorder. This may be because of avoidant coping and transition methods that are not used during the transition for a gender change, as well as discrimination and social stigma that this population is undergoing as well. According to a survey in 2011 from the National Center for Transgender Equality, 63% experienced a great amount of discrimination in their lifetime, and 41% attempted to commit suicide. Helping those in this community to have access to counseling and health care and transition therapies such as hormone therapies may greatly improve the mental health of these individuals. Promising studies by the American Psychological Association show help may occur for online support groups. Those who are lesbian, gay, bisexual, or transgender oftentimes do not feel comfortable and do not trust those who are having a one-on-one, face-to-face support group, but having the online support groups may help relieve some of these mental health disorders.
The obesity rate in America is growing rapidly, which has become a pretty well-known fact. More specifically, a big problem that is evident in today's society is the obesity rate of lesbian and bisexual women. According to Healthy People 2020, lesbian and bisexual females are more likely to be overweight than heterosexual women. In the spring of 2006, a study was conducted by the American College Health Association on the obesity rates of lesbians and bisexual women. The study was focused primarily on the college age level from 18 to 25 years old. The results showed that lesbian and bisexual women were more likely to be overweight than heterosexual women. The study that was done to come to this conclusion included surveys of students from 23 different institutions. The students would identify their sexual orientation at the beginning of the survey, and the study only took into consideration and analyzed the data from surveys done by heterosexual, lesbian, and bisexual women. There were a total of 31,500 women whose surveys were analyzed. Of that number, 95% identified themselves as heterosexual, 1% identified themselves as lesbian, and 3% identified themselves as bisexual. According to the answers that the women provided, the mean BMI for heterosexuals was 23.12. The mean for lesbians was 24.77, and the mean for bisexuals was 24.54. This indicated that lesbians and bisexuals do have an average BMI slightly higher than heterosexual women. The study also revealed with further analysis that 35.2% of lesbians and 35.1% of bisexual women are overweight, whereas only 22.8% of heterosexual women are overweight. One of the limitations of this study, however, is that there is not a large amount of evidence for the fact that lesbian and bisexual women are at a higher risk for obesity because of the significant difference in numbers between heterosexuals, lesbians, and bisexuals that were surveyed. Since there is a large population of heterosexual women than there are lesbians or bisexual women, the data may not effectively reflect the obesity rates. There have been some studies done, however, that have revealed that lesbian and bisexual women may not have as high motivation for physical appearance compared to the heterosexual women. This fact may play a part in determining the reasons for an increase in obesity in the lesbian and bisexual community. To examine the differences in lesbian and heterosexual women's idea about body image, Sherry Bergeron and Charlene Sen looked at the overall differences of body image from women of different sexual orientation. The study concluded that lesbians generally have a healthier body image than heterosexual women, so they are more comfortable with how they are weight-wise. The process of determining this included surveys from 108 lesbians and 115 heterosexual women, so these numbers are a little more equal than the previous study discussed. Bergeron and Sen concluded that society has placed an emphasis for women to look their best in order to please men. Lesbian women, however, do not have the same desire to please men. As a result, there is less pressure on lesbian women to have the perfect body. What we as health educators can learn from these studies is that the lesbian and bisexual population often do get overlooked in weight loss programs. Many weight loss programs are designed for generally just men and women, but there is not an emphasis on the lesbian and bisexual population. Though there may not be as much social pressure on the lesbian and bisexual women to have a well-toned and perfect body compared to heterosexual women, Physical health is still just as important. Health programs specifically targeting the lesbian and bisexual community will aid in stopping the rise of obesity in lesbian and bisexual women.
HIV and STD in LGBT population are focusing on men that have sex with men. According to the Health People 2020, LGBT encompasses of all races, ethnicity, religion, and social class. According to the research that was done by Center for Disease Control, the most recent data shows that between 2006 and 2009, the number of new infections that occur each year has increased among young men. It has increased by 48%, that is among black young men, at the age of 13 years to 29 years old. This data clearly shows that the urgent need to expand access to proven HIV prevention programs for gay and bisexual men and to develop a new approach to fight HIV in this population. Men that have sex with men accounts for nearly half of the 1.1 million of people living with HIV and AIDS in the United States. That is 52%, or an estimated of 592,100 total in person. Men that have sex with men account for more than half of all the new HIV infections in the United States each year. That is like 61%, or an estimated of 29,300 infections. According to the latest estimates, white men that have sex with men represent the largest number of new HIV infections, that is 11,400 whites, 10,800 blacks, and 600,000 men that have sex, Hispanic population. AIDS continues to be the claim of lives of many men that have sex with men. Since the beginning of epidemic, more than 296,000 men that have sex with men have died. According to CDC in 2013, men that have sex with men account for 63% of the estimated new HIV infection in the US and 78% of infection among new infected men. A complex factor that increases the risk of the spread of HIV in men that have sex with men is lack of knowledge of infection status. A high percent of infected men who have sex with men do not know they are infected, and those who are infected, they take little measures and they end up spreading the virus to other people. Use of alcohol and illegal drugs also has an impact. Men that have sex with men can lead to risk sexual behavior due to drugs that they use. A mental health consequence of stigma and discrimination, for example, bullying, harassment, and family disapproval, and also social isolations. They also leads to men that have sex with men, especially homosexual, and ending up having sex and spreading the infections to others too. According to CDC, sexually transmitted disease have been increasing among gay and bisexual men. A recent increase in syphilis cases have been documented across the country. In 2008, men who have sex with men accounted 60% of primary and secondary syphilis cases in the United States. Men are often diagnosed with other bacterial STDs, including chlamydia and gonorrhea. The most STDs in the United States is papillomavirus. How STDs are spread. Gonorrhea and chlamydia are sexually transmitted by genital secretion such as urethra or secretion from the penis. Genital herpes and syphilis are transmitted primarily through skin-to-skin contact with sores and ulcers or infected skin that looks normal. HPV is transmitted through contact with infected genital skin or mucosal surfaces or secretions such as the penis and the anus. Signs and symptoms of STDs: discharge from your penis, pain, burning or itching around the opening of your penis when you urinate, anal itching, soreness and bleeding or discharge, a single source or multiple sources on the penis, painful blisters around the genital or anus, warts on the genital areas including the penis and the scrotum. Prevention of HIV and STDs in men that have sex with men. The best method to prevent HIV from spreading, especially among men that have sex with men, is having one sexual partner. Whether you're having sex anal, vaginal, or oral, you just need to stick to one partner. Use of condom when involving sexual activity is very encouraging when having sex, especially with men that have sex with men. And the best method also to get tested each year, especially if you know you're having sex, and it's very encouraging and imperative for you to be tested every year to know the risk and how well you are. The work of CDC, Center for Disease Control, is to encourage men that have sex with men to go get tested and encourage them to get advantage of our medical approaches to HIV prevention. Pre-exposure of prophylaxis, which involves taking the antiviral medications prior to becoming exposed to HIV, can reduce the risk of HIV infections in individuals at very high risk of infections. It also continues to focus on HIV testing to expand high prevention of services for young gay and bisexual men of color and transgender of youth color and their partners. CDC is awarded $55 million over 5 years to 34 community-based organizations with strongly links to these populations. The funding will be able to provide HIV testing for more than 90,000 young gay and bisexual men and transgender youth of color. According to the Health People 2020, continuing issue in LGBT health community, especially the transgender population, exploration of sexual gender and identity among youth, need for LGBT wellness more.
Another important health disparity amongst the lesbian, gay, bisexual, transgender community that the Health of Today organization and Healthy People 2020 want to address and see decrease is substance abuse and tobacco use. According to the Healthy People 2020, LGBT individuals face health disparities linked to social stigma, discrimination, and denial of their human or civil rights. The LGBT population have the highest rates of tobacco, alcohol, and other drug use. We believe that being culturally sensitive towards the LGBT community is essential in being successful towards preventive services and treatment programs. According to the Center for Disease Control, LGBT individuals are more likely to use alcohol and other drugs, have a higher rate of substance abuse, they are less likely to abstain from them, and are more likely to continue heavy drinking into later life. It is believed that substance abuse is related to a wide range of mental and physical health issues. Alcohol abuse can lead to broken relationships, trouble with employment, and unstable finances. A study done by the University of Kentucky shows the prevalence and demographic predictors of illicit and illicit drug use among lesbian and gay men. Data was collected through mail-in surveys where 265 gay men and 190 lesbian women participated. The usage of 6 illicit drugs, 2 illicit drugs, and 4 non-medical use of psychotherapeutic drugs were investigated through the survey. Marijuana and inhalants were the most popular illicit drugs reported used by gay men, and cigarette use was alarming amongst lesbian women. Amongst adults ages 26 to 34, 73% men and 55.2% of the women have used alcohol in the month prior to the survey. Healthcare providers need to understand that LGBT communities have unique needs essential for the healthcare system. Theoretically, internalized homophobia and heterosexism may relate to alcohol abuse. It is not only gay men and women, but also transgender individuals who also have a serious issue with substance abuse. A study to improve the health of transgender individuals in Virginia was conducted by the Community Health Research Initiative of Virginia Commonwealth University and identified 93% of transgender individuals have a habit of consuming alcohol, and 39% of them found it to be a problem. 65% used tobacco, and 36% felt it was a problem. The median age of drinkers were 19 years for females to male, and 22 years for males to female transgenders. The median age the problem smokers first noticed it was a problem was 18 years for females to males, and 21 years for males to female transgenders. A study done on sexual orientation and substance abuse treatment utilization in the United States, where around 34,000 adults participated, all over the age of 20, had estimated around 2% of the priority population that identified themselves as lesbian, gay, bisexual, or transgender. The majority of respondents with substance abuse use disorders were untreated, and lifetime substance abuse treatment utilization differed based on sexual orientation. Sexual minorities were found to have more extensive family histories of substance abuse problems. What factors contribute to the prevalence of substance abuse among gays and lesbian women? Until around 1973, homosexuality was defined as a mental illness by the American Psychiatric Association. Alcoholism and substance abuse, once treated solely as illegal problems, now are seen as illnesses of the mind, body, and spirit. Today, this myth has been dispelled by research. Instead, scientists believe that societal factors affect the relationship between substance abuse and the LGBT community. Heterosexism. What is heterosexism? Heterosexism is defined as the stigmatization of non-heterosexual forms of emotional and affectional expression, sexual behavior, or community. Negative covert messages about the gay and lesbian lifestyle, as well as incidents of hate, forms of threat, acts of humiliation, emotional abuse, and other negative acts. Also, other common examples of heterosexism include rejection by family and peers, loss of employment, lack of promotion, observing or hearing people make heterosexist jokes. Heterosexism can contribute to an internalized homophobia, shame, and a negative self-concept. Barriers in treatment services. Heterosexism plays a major barrier that people have to get over. We have to find ways of treating them, treating the LGBT community, because they are a special community in the United States today. Substance abuse treatment facilities are often not able to meet the needs of this population. The treatment staff of such facilities may have varying heterosexist assumptions regarding the LGBT clients who access their service. They may be uninformed about LGBT issues and insensitive to or antagonist towards LGBT clients. There are various treatment methods that we could use to face the LGBT community, but we have to realize that there's more to their alcoholism than just being lesbian, gay, bisexual, or transgender. Has to do a lot with their mental barriers, and that's something that we have to face.
Bullying is another issue in the LGBT community. Bullying is unwanted, aggressive behavior among peers that involves a real or perceived power imbalance. According to Healthy People 2020, research suggests that LGBT individuals face health disparities linked to social stigma, bullying, discrimination, and denial of civil and human rights. The goal of Healthy People 2020 for LGBT is to improve the health, safety, and well-being of lesbians, gay, bisexual, and transgender individuals. In society, negative attitudes towards the gay, lesbian, bisexual, and transgender people put LGBT youth at increased risk for experiences with violence. According to the Center for Disease Control, in a 2009 survey, more than 7,000 LGBT school students aged 13 to 21 years found that 8 in 10 students had been verbally harassed at school, 6 in 10 felt unsafe at school, 4 in 10 had been physically harassed at school, and 1 in 5 had been the victim of physical assault. In another survey done by the CDC, more than 7,000 students between 7th and 8th grade, LGBT youth were more likely than heterosexual youth to report high levels of bullying and substance use. Also, students who were questioning their sexual orientation reported more bullying, homophobic victimization, unexcused absences from school, drug use, feelings of depression, and suicidal behaviors than either heterosexual or LGBT students. The survey also showed that all students, regardless of sexual orientation, reported the lowest levels of depression, suicidal thoughts and feelings, alcohol and marijuana use, and unexcused absences from school when they were in a positive school climate and not experience homophobic teasing. For youth to thrive in their schools and communities, they need to feel socially, emotionally, and physically safe and supported. What schools can do to prevent bullying is to encourage respect for all students and prohibit bullying, harassment, and violence against all students. Schools can also identify safe spaces such as counselors' offices, designated classrooms, or student organizations where LGBT youth can receive support from administrators, teachers, and other school staff. Schools should also encourage student-led and student-organized clubs that promote a safe, welcoming, and accepting environment, like the Gay and Straight Alliance, which are school clubs open to the youth of all sexual orientations. Schools can also ensure that the health curricula or education material use inclusive language and terminology. They can also facilitate access to community-based providers who have experience in providing social and physiological services to LGBT, like counselors. No bullying tolerance policy for students who bully, and the school should have consequences for all types of bullyings. Parents should also step in and help LGBT students in the community. Parents should talk openly to their children about any problems or concerns and be watchful of behaviors that might indicate that their children are victims of bullying or violence. If parents suspect any signs of bullying, they should take immediate action, working with school personnel and other adults in the community to prevent bullying from happening. Parents should also be careful in how they respond to their children when they come to them and tell them that they are gay, lesbian, or transgender. In some cases, children have been thrown out of their homes, shunned or ignored or even rejected, and this can have very severe consequences. Parents whose children are bullies should be notified by the school so that they can help their children in learning how to deal with bullying and learn not to be bullies as well. For more information on bullying, mental health, HIV, obesity, and drug abuse in the LGBT community, contact the cdc.gov or Healthy People 2020. Thank you for listening.